Hi there, and welcome to this demonstration of Clinical Nutrition Center Patient Chart. If this is your first time viewing this application, I hope you enjoy taking a quick look at some of the features that this has to offer. I'm Dr. Ethan Lazarus, and this is the first of many instructional videos. Right now we're looking at the screen that you'll see after you log in. You should have received login instructions from your system administrator. The screen is generally divided into two areas. On the left side are menus, where you can go to different areas of the chart or access different administrative or practice management features. This is also where you can access the help menu and resources. On the right side is generally where you'll be viewing information. So you'll be viewing the patient chart, you'll be viewing your options, and so on and so forth. So let's get started. Why don't we go ahead and pull up a chart? To do that, it's really easy. Just go to the last name contains, and you'll notice that this screen comes up blank on purpose to respect patient privacy, so that names aren't shown. If there happens to be a patient in your office, they won't see the other patient's names. And to get back to this screen at any time, just go over here and click on Patient Search, and you'll be returned. In last name contains, you can go ahead and type the last name of a patient that you're wanting to find. For example, I might search for a sample patient myself and click search, and then you can see the system quickly finds any patients whose last name contains the letters that you put in the search box. This pulls up the patient's name, and it shows you just a little bit of information on the patient, the birth date, so you can make sure you got the right patient, whether it's an active file or not, which will be discussed later. Patient ID is used throughout the system to find records. And then these are 5 basic areas in the chart, and you can click any of these to go directly to that part of the patient's chart. Chart is patient's notes and vital signs. Tests might be blood work, urinalyses, and EKGs. Communications can be inter-office communications or communications with the patient. Scans and pictures is a great place to attach outside documents or to take pictures of patients and see how they look over time. And dispensing is a comprehensive portion of the program to aid in office dispensing. So just to take a quick look at what happens if we pull up a chart, we're going to click on Chart for patient Ethan Lazarus. And when the chart is pulled up, the CNC patient chart logic system goes ahead and generates a chart header for you. Now, depending on your user level, whether you're a front office or a dietitian or a medical provider, the information up here on the top may be slightly different. And depending on which options you've chosen for your personal preferences, it may show more or less here as well. And this is all customizable. But for me, as a medical provider, I have it set just to show some basic information, and then I have it put a whole lot of other information in the menus, which I'll show you in a minute. So you can see here that it pulled up patient Ethan Lazarus. It shows you my last picture. And you can see over here a few things about me. I have no allergies. I started my weight loss program in February, and my last weigh-in was November 26th, and it shows you some of the changes that I've had over time. It indicates that this current weight loss attempt has been going on for 345 days. The middle box for me is System Messages. System Messages is an area where the computer looks at all the different tables in the chart and tries to make smart recommendations. For example, for patient Ethan Lazarus, the computer sees that the patient's on a modified fast, but urine ketones haven't been checked today. It reminds me that the patient has diabetes and the A1C is up to date. It tells me I'm missing some signatures on various informed consent documents, and it shows me some to-dos and a prescription that's going to come due soon. In general, anything in yellow is thought to be important and probably needs to be looked at more carefully. The others are just for reference. Flags up here on the right, that's kind of like having yellow stickies on front of the chart to remind you of important things like patient prefers to be called Bob, or don't step on his foot, or do blood pressures on the left arm. And all of these can be adjusted. And then on the bottom right over here, it's showing me the patient's current meal plan, lesson plan, when he's due to see the doctor again. Scrolling down, when you clicked into the chart, The chart has various sub-tabs, so you can have vital signs, dietitian notes, MD notes, and so on and so forth. When you click on chart, it takes you straight to the vital signs table. If you scroll down a little bit, you can see that it's giving me a list of the last many visits. It's the list of the last 20 visits, or I can do more or less than that if I'd like. And it shows me the date of the visit, whether the patient's on MD or an RD or both, the meal plan that they're on at that visit, patient's weight, vital signs if they were done, calculates out the body mass index, the body fat if that was done. Note here in case we did urine ketones, and it tells me the patient's weight loss total and weight loss or gain from the last visit. So here they were 200 pounds, here 198, so the weight loss was 2 pounds. That'll be negative if there was a gain. On the right is billing codes. The system tries to track what was done at each visit to aid to make sure we do proper billing, although at this point in time this is not a comprehensive billing module. We'll talk more about billing in a later video. So that's a general view that you might see of a patient in their different tables. Let me give you a quick look at some of the different options you're going to be faced with on the left side of the screen. So if you click Patient Search, it'll take you back to the original search dialog. If you mouse over or on a tablet click on the patient's picture, this is what I call a quick view. This gives you a way to take a peek into any of the chart tabs without actually leaving what you're doing. So say you're entering a note and you can't remember the patient's medical history and you want to look at that. You can just mouse over the medical history and you can see that this patient has metabolic syndrome and diabetes and so on and so forth. Or I can mouse over allergies, their weight, some basic demographics if I want to give them a call or see who their primary care doctor is. This gives me a look at the recent office dispensing, and you can see that the patient just has one refill left on metformin. Flags, again, we talked about already. Staff to do, if there's things the staff was asked to do, this gives a list of who's supposed to do what and when. System messages you already see displayed in the header. The patient's medications, when they should see the MD next. Tests will show the last few sets of labs and or EKG and various other views that you can access. In addition, depending on the type of header you have, you may have a quick view, which gives a few other fields all at once, so that if, for example, I'm entering a doctor's note, I can mouse over Quick View and quickly see pertinent information. Below the patient's picture and Quick View, if you're shown that based on how you have your preferences set up, now you'll see all the patient's tabs for their chart. So under the chart, again, you can see vitals. That takes you to the same tab that we were already in. And the tabs are the same as what you're seeing in this horizontal menu bar that was put there as a second way to get into those for quick access. You can go to the registered dietitian notes, the MD notes. You can edit the patient's medication list, their primary and secondary diagnoses, their medical history. And you can get into their weight loss programs, which will be talked about in a future video, and even their exercise prescriptions. Tests is the area of the chart where you can enter or view patients' labs. So if we go to labs, for example, you can see some of the patient's recent labs. Also in tests, you can go to their urinalyses. You can go straight into their EKGs and view all of their EKGs. You can view the patient's body fats, and the computer does a fair amount of math for us, even calculating resting metabolic rate. Other is a spot for other tests, and PHQ stands for Patient Health Questionnaire. That's an area that we can use to do depression screening and follow-up for patients. Communications really is anything to do with information to and from the patient. The first tab, Demographics, will take us to the patient's original history, let us change things like their address and their cell phone number or their email or whatever. Messages is an area to do patient messaging, whether phone, fax, or email. You can view the messages, record messages from the patient if they called us, or we can add a message to the patient if we call them or want to send them a secure message. Staff to do is a part of the chart where we can issue orders to other staff, asking them to do things. For example, please call the patient in 1 week to make sure their abdominal pain is feeling better, or so on and so forth. Flags is an area on the chart where we can have important items highlighted that are going to be shown on the header. Letters is to generate letters either to the patient or their primary care doctor. Chart export is the part of the chart that we would use if we need to generate notes to send to other doctors or if a patient requests medical records. Informed consent documents, this is where we can get patient signatures, and we can either have them sign them right on a tablet, or we can have them fill out a form and we can scan that form here. And a patient food journal, that's a comprehensive food and exercise journal that we'll talk about in a later video. Scans and pictures, this is where we would attach documents. So if we want to attach the patient's old chart, or if we want to attach, take a new picture of the patient as they lose weight, we would do that from this area. Dispensing is a comprehensive dispensing system that'll track medication orders and medications dispensed, both for an individual patient and for the whole practice. And graphs is a lot of fun. Patients will love this. This is where you can go get a graph of what the patient's body fat is doing, and you can plot it out for them. So you can see this patient's body fat has been going down over the year. You can see the patient's lean body weight and fat weight have been going down over the year. The rest of the options below this line where it says admin no longer deal with patient Ethan Lazarus. These are now going to be general options for the whole practice. You have a practice management area. This has a lot of powerful options and will be discussed in later videos. A help area, so if you go over the help area, that'll display links to help videos such as this one, and you can learn about different functions of the CNC patient chart. Resources is quick links for any documents that we've added to the system that may be useful while we're seeing patients. So you can see we've added some package inserts for some of the common medications that we use, and clicking that will take you straight to them. And then if you scroll down, we get to the to-do list. And so I'm logged in as myself, Ethan Lazarus, and each time the computer generates this menu bar, it looks through its database to see if I have to-dos that need to be done. So, for example, right now I have a message from John Smith I need to address, and clicking on John Smith would take me straight to that message. So when I go to John Smith, you can see it pulls up a different patient, it regenerates all of the different menu options, regenerates a new header, and takes me straight to John Smith's message that needs a reply. The computer keeps an eye on whether I've signed off on all my notes. So for doctors and PAs and registered dietitians, if the computer sees that you started a note but didn't sign off on it, it'll display that here, and it tells me the date that that note was written. Of course, in parentheses, you can see the 1 means there's one message. This means there's one unsigned note. And tests are any tests waiting for review. So I might in there see labs, or EKGs that I need to review and sign off on. So you can see I have 7 EKGs that I need to review right now, or excuse me, 7 labs, and 4 EKGs for Pillsbury Doughboy and Barack Obama. So again, if I click that, it takes me straight to what I would need to be reviewing and lets me go ahead and review it. These two need MD review. We'll talk about how those features work in a later video. And at the bottom is a change password area, or you can log out to complete your session on the CNC patient chart. So I hope you've enjoyed your overview of the CNC patient chart, and future videos will deal with each of these different menu items and each of the different screens. Thanks, and have a great day.